dos alimentos. It is a great pleasure to be here today with one of the greatest doctors and scientists I have ever met. It's Dr. Jeffrey Brooks, the creator of the Spatz balloon, a brilliant mind that has invented the only adjustable intra-gastric balloon available in the whole world. For starters, we have to explain what an intra-gastric balloon is. It is a space-occupying device that is inserted during an upper endoscopy without any cuts or any need for hospitalization. As a matter of fact, many day hospitals and clinics throughout the world place them under sedation without the need of intubation. So it's a safe, well-established method that we endoscopists have been performing for decades. Also being an obstacle for food to get to the duodenum freely, which is the next step regarding digestion, there is no need for making a lot of meals throughout the day. Let me clear things out. If there's still food from lunch and it's time for dinner, the patient for sure is going to eat less. Of course, we need a proper diet in order to achieve the best results, of course. But the balloon gives a chance for the patient to embrace new eating habits, healthy ones, and to begin exercising in a regular basis. Well, that being said, it's a true honor to have you, Dr. Brooks, with here today. Thank you for your precious time. And Dr. Brooks, how did you came up with this amazing idea? Tell us.
Well, first of all, thank you very much for the invitation and the very, very kind words. Like you said, you know, intragastric balloons are such an important part of our armamentarium. People want to lose weight. It's part, we all think about it. We all want to live long, healthy lives. And bariatric surgery is excellent, but we know that it's a very aggressive procedure and has its side effects. And in fact, at least I can tell you in the United States, and it may be true around the world, less than 1% of patients who are eligible for bariatric surgery will actually undergo it. 99% do not want to do it. They need an alternative. So this is not replacing bariatric surgery. Bariatric surgery is excellent and it's appropriate. But there are a lot of people who want something else. This is an excellent alternative. And what's interesting is that I think since we brought in the adjustable intragastric balloon, our results, which have been shown in FDA trials, come even close to bariatric surgery results. So it's adjustability that makes the difference. You see, when I first set out to bring this balloon to market, I looked at the drawbacks of intragastric balloons. They're excellent. They really work. The balloons that are on the market are excellent, high quality balloons. What were their shortcomings? One was that up to 10%, depending on the study, up to 10% of patients are intolerant and they have to take the balloon out within the first month or so. In some studies, it's 3%, some studies it's 7 or 8%, but up to 10%. I said, how can we alleviate that problem? The second issue is that in all studies, they show that most of the weight that is lost with a 6-month balloon occurs in the first 2-3 months. And then the last 3 or 4 months, not much happens. So I thought perhaps if we can make a balloon bigger and rejuvenate the balloon, we'll get extra weight loss. And that's what we set out to do. And we accomplished that with the Spatz adjustable balloon. So we've had, you know, we're already getting close to 80,000 balloons in 60 countries around the world. And our results have shown that at least for those intolerant patients that are willing to undergo a down adjustment, it's a 5 or 7 minute procedure. You make the balloon smaller and their intolerance goes away immediately. It's quite impressive. We save those patients from an early extraction. And those patients at 3 or 4 months, when their balloon effect wears off, not all balloons wear off at 3 or 4 months, but a lot. And I'd say about half of our patients want to have an up adjustment. So we make the balloon larger. The balloon is larger, takes up more space. It has more of an effect. It rejuvenates the effect that wore off already. And those patients benefit by having extra weight loss. So with the combination of saving those patients from early extraction in about 10% of patients, and about 40 or 50% of patients who need to have that extra push at month 3, 4, 5, or 6, those patients together make the response rate of the Spatz balloon much higher than regular balloons. Most other balloons will have less than a 50% response rate. That means that less than half of the patients will really have a good result.
Yes.
With the Spatz balloon, at least in the FDA trials, 84% of our patients had a positive response. And that's because of the adjustment. And that's very important. Secondly, of course, we've extended the period. So we're the first balloon ever to extend the period of treatment from 6 months to 12 months. And that's a very important part because it's not just about what the balloon does for you, it stops you from eating. It does that for a while. But afterwards, it's a wonderful behavior modification tool because the balloon doesn't suddenly give you nausea and vomiting. That may be the first 3 or 4 days. But after the first month or so, you get used to the balloon. And the balloon sends you warnings before it sends you those terrible symptoms. It'll send you burps and bloating and fullness, things that are not, they don't make you miserable, but they remind you,
that
hey,
wear the device.
So much over the last week. And if you continue this way, a week or so from now, if you continue eating like that and ignore these, what we call signals, you're going to have nausea and vomiting. So this is your opportunity. It's a gift that only a Spatz balloon can offer here. That's the time when you can accept those signals and then make a change. And that's the back and forth. That's the behavior modification. I think what's so important for people to realize when they go into a balloon treatment, it's not about what the balloon is doing for you. It's what you're doing with the balloon together, accepting its impulses, accepting its signals and symptoms, and making changes. It's like having someone on your shoulder tapping you and saying, "Are you sure you want to eat that?" You know,
you're being very polite. Sometimes I tell my patients it's a kind of leash, like a dog that needs a leash to learn how to behave properly.
A lot of people use personal trainers that come to their homes and they do exercise with the personal trainer. It's like having a personal trainer because without the personal trainer, you may not do it.
Perfect.
But if the personal trainer is there, they tell you how to do it. That's what the balloon is. And you have to accept it as such that it's helping you make the change.
Oh, that's brilliant. And what are your personal comments? Because you've said about the time of treatment, and I do agree with you that a 12-month treatment is very good, and it's the best approach for really encouraging our good habits and everything else. Nowadays we have the swallowable balloons, but the swallowable balloons it's just a 4-month thing. So it doesn't convince me at all. What are your personal opinions about that? I know we're not talking, they are nonsense and everything else, but in my point of view, we need an extra time that they can provide us. And I
agree with you. I think those are probably similar to my sentiments. The swallowable balloons are such a brilliant technology. I think it's elegant. I think it's wonderful, but it's limited in its time period. And at least in FDA trials, the Obalon, which is a swallowable balloon, they only had a 24.7% response rate. It means that 3 out of 4 patients who had an Obalon inserted during the FDA trial had weight loss, significant weight loss. 3 out of 4 did not, 1 out of 4 did. So it's a nice technology. It's a quick fix. I like it. There's another balloon that's coming out, Allurian, that is also a swallowable balloon, and it also goes out on its own. It's an even more brilliant technology, and it's a wonderful
we have Allurian over here. We don't have Obalon.
We have Allurian. Right. So that has better results than the Obalon. It does not require endoscopy, and that is its benefit. But it also doesn't have the same degree of weight loss that something like the Spatz balloon would have.
You are just losing the adjustability. So I'd like to ask a personal question, because I myself have those strokes of serendipity during my sleepless nights because I suffer from chronic insomnia. But can you reveal us your personal secret? How did you came up with the idea of adjustability?
So you know something? Well, I saw, as I mentioned earlier, I knew that we had to make a balloon adjustable because I saw the limitations, the early intolerance, the lack of effect after 3 or 4 months. What took time is developing the technique. So whatever I thought of on day one was it was definitely not good by day 3. And it changed over, probably weeks and a month or two. You develop it, you sleep on it, you work with your engineer on it. They say, this can be done. My engineer and I have a great relationship. I say, I want you to do this. He says, it can't be done. And I'll say, yes, it can. And then the next day he says, I think it can be done. So you have to have the dreaming. I'm sort of mechanically inclined, and I think about these things mechanically. And you have to have a brilliant engineer to work with you to make it elegant and, and something that's robust and repeatable.
Yes, of course.
Yeah.
And how do you see, we were talking before going live, but how do you see balloon implantations nowadays during pandemics? Because over here we have, I've never put out so many balloons. I've never placed so many balloons as for now, because the pandemics are just, obesity is just with tight hands to the severe forms of COVID-19. So many patients are looking for intragastric balloons, for they don't need to go to an open surgery and so forth. They don't need to go to hospitals and so forth. And I think it's a very secure method. As a matter of fact, we are just writing a paper about our patients who had the balloon implants and then developed the COVID, and they did not need hospitalization. So it's a very good thumbs up for the method. What do you think about that? Are you seeing the same thing?
Yes, Dr. Anna, I agree. We're seeing that probably over the last 5 or 6 months, we're sending out as many balloons as we did prior to COVID. And we understand the mentality of our population of patients. They're coming out of this terrible dark period. They were stuck at home. They were frightened for their lives. And finally, vaccines are coming. There's hope. Everyone sees the light at the end of the tunnel. And they say, wow, we're going to live through this. Yeah. Life will come back to normal. But you know what? I've got to get back on the wagon. I've got to, eat better, live a healthier lifestyle. And that's where balloons come in. You're right. Surgery is a very drastic step. This is something that's totally reversible, repeatable, not as dangerous as surgery. So it's a very, very appealing alternative. And I think it shows it. What's interesting, I've seen technologies come and go over the last 15 years. Balloons have been there from the beginning, and they are still here, and they will be here. And I'll tell you something very interesting. United States always leads in insurance sort of matters. The insurance companies in the United States are now recognizing intragastric balloons. They have what we call a CPT code, which means if you have a balloon placed in the United States, it'll start next year. If you will have a balloon placed in the United States, it is covered by insurance. This has never happened before. I've seen it occasionally, but this will be a policy in the United States, within a year or so, which will make things very, very different. We're going to see more balloons coming out. And I'll tell you something, we have another technology coming out. We call it Spatz 4. We'll be starting trials in about 4 months from now. We're very excited about that. So there's always exciting thing. And not only that, so that is done. The prototype is made. We know it's great, and we're going to start testing it so we can bring it to the market. I already have the next version in my head. So that'll be a number of years after that. But yeah, you always have to, when you get something done really well, you have to stop and freeze at one point. That's the hard part. I would change it every other day if I could. I'm always fine. Oh, let me fix this. Let me fix that. So, you have to stop at one point. And, so I have some other great ideas for about 2-3 years from now. But I think we'll have Spatz 4 available in over a year.
You should never stop. It's just like iPhone. We are iPhone 12, and
right.
You know that it will be an iPhone 13 and 14. And I hope the same for Spatz, because you have a great, brilliant mind, and you have to just put steps into that so we can adjust and learn how to play with the devices. But
yes,
it's brilliant. Do go on, please.
Yes, we'll keep going. We will keep going.
Oh, it's just about that. About almost 2 years ago, I had Spatz 4 held in my hand. So I'm
That's
looking
correct.
forward to working with the Spatz 4.
Yeah.
Yeah,
to get it exactly the way you want it. The final details are so important engineering wise, and we test them in a very rugged way to put them under extreme conditions. So you have to make it really, really good. So we're there. We passed our test, and it'll be ready to be tested in a few months.
Dr. Brooks, I've seen many good results, regarding NASH and intragastric balloons. And I think that's the main reason the US are just opening them for the insurance to pay for them. Do you have these results regarding Spatz? Because I didn't have the time to look, but I know you can answer all of us about that.
Well, there are scattered studies about intragastric balloons yielding weight loss and improving NASH.
Yes, of course.
For sure there are. I can't quote them for you now, but I can tell you that I have a study that is literally starting next week in Portugal.
Oh, that's good.
Looking at that right now, because they have a fair amount of NASH there. And you're right, in the United States, they see that liver cirrhosis is a frightening, finding on the landscape. And NASH is one of the big contributors. We're taking care of hepatitis C, hepatitis B, we got good drugs and we're doing better there, but NASH is a frightening thing on the landscape. So I think when balloons are used more often, we're going to see fewer patients with NASH and cirrhosis in the future.
What I think the most important is that we are able to deal with our patients at a lower BMI with intragastric balloons, instead of just waiting for them to reach like 35 or 40 BMI before just going into surgery. So you have a BMI cut of 27 here in Brazil. I don't know how it works in Israel or in the US.
Different places.
Yes, of course.
20, some place 27, some 30. Depends on the place.
Oh, here in our consensus, the Brazilian consensus, we have dropped it to 25 because we think it's a good way of just preventing obesity from happening. And this is it's been in lots of papers that I'm reading nowadays how to prevent obesity. Okay, we have to think about eating habits, but once it's there, what can be done? And how about children? How do you prescribe Spatz balloon for children? Because I have placed them in children of 12, and nowadays children are getting fatter and fatter. And what do you think about that? Because Spatz is the only one we can just try and mitigate those complications from the beginning and the early removals. So I think it's the best option when we come to a balloon for children. What are your thoughts about that?
Yeah, I agree, Dr. Anna. Pediatrics, we should not ignore that population for obvious reasons. Getting devices approved for the pediatric population is challenging. First, you have to prove that it works in adults. Then you first get, to children, and we're there now. We're ready to do this with children. You have to find the right pediatric center. The other challenge with children is, and this is where adjustable balloons come in, with balloons, as you know, you need to have the correct attitude. Patients who come in thinking this is a magic pill, I put the balloon in and I stop eating, that's not what balloons do. You and I know that very well, and I think I explained that earlier. So you need to have the proper attitude. And to get a pediatric age kid to realize that, no, you have to work with the balloon. The balloon is going to help you. It's not going to stop you and prevent you from eating all the time. It's going to help you, and you got to work with it. You need a mature kid who has, a good level of intelligence and maturity. So that's not so simple. So I think there'll be, a segment of the pediatric population that will be, appropriate for this sort of treatment. And that's where we'll start. So that's coming next.
Oh, that's good. And nice parents to embrace the idea. They are not
right
to solve problems, because the problems are inside their homes. No. I could spend hours and hours discussing this brilliant device. But I do think we are past our due time because there are lots of things.
Okay.
Today's Sunday. And I would ask you kindly if we could repeat in the near future for doctors, because it's a good way. Many doctors, especially endocrinologists and clinicians, doesn't know the method yet. And we have to just tell them through and teach them because it's a very good way of losing weight. Dr. Brooks, please add your final considerations for today's meeting, and really hoping to see you soon. As I said before, not only here, but at our congresses.
Yes, hopefully we'll all be in congresses together. Certainly, I suspect certainly within a year, maybe within 6 months if we're lucky. Maybe just those who get vaccinated are allowed entry. That's where we're going to start in this world. So I thank you for the opportunity. I'd be very happy to speak again in this forum with doctors on any of these topics that are near and dear to my heart as well. And I think it's very good, instructional for those doctors who are unaware, because there isn't, I don't think everyone knows about this. I mean, I think all doctors know about bariatric surgery. Some doctors know about intragastric balloons. And I think we need to spread the word.
So my crew here is telling me to speak a little word in Portuguese. Just hang on.
Sure.
What we are discussing right now. So, o que a gente está discutindo aqui é que poucos médicos, poucas pessoas ainda sabem da existência do balão intragástrico, e é uma alternativa que está longe da cirurgia bariátrica, não é mutilante, o estômago não cresce, dá para repetir. Quando você tira, você simplesmente aprendeu a comer de um modo diferente, e aí o balão ele serviu como uma muleta, mas você aprendeu a andar, e aí você pode largar essa muleta daí por diante. O que eu e o Dr. Jeff estamos combinando é da gente fazer outras lives, a gente vai colocar outras pessoas junto, e também fazer para médicos que estejam interessados e que desconheçam a técnica. So I was just telling them that the Intra-Gastric balloon, what we were discussing earlier, and just to remind them that they are a big part of that, being educated towards the existence of intragastric balloons, or asking their doctors. So that this is the thing we need to make more lives and to present them to the doctors that don't know the technique yet. And also reminding that I like to combine things. We had just the last paper I've published was regarding the weight maintenance after the balloon retrieval, after the Spatz 3 balloon. So we have great results. It doesn't mean that the patient can have a second balloon. Of course not. We have to study each patient and to study the prices of drugs, because they are pretty high too. So we have to know our patients and to offer the best for them. But it's been the greatest talk, and I just have to thank you again for your precious time.
My pleasure.
And
my pleasure. And thank you for the opportunity. We'll speak again, I'm sure.
Very soon. Thank you.
Stay safe and well.
Too.
Be well. Bye-bye. Thank you.